Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Health Care. We're talking about the Great American Smokeout, which is the third Thursday in November. What is the Great American Smokeout?
Great American Smokeout is a day in November. It's usually always the third Thursday when we use the day to remind people to quit smoking. And it got started in the 70s as a way to help people think about just even quitting for the day. And if they could get through one day without nicotine, then maybe they could think about quitting for the long run.
What is the best way to quit smoking?
There are multiple ways to improve the percentage of quit smoking. You can do mono, which is just taking the medicines that are there, the FDA-approved medications, or you can also increase your success rate by quitting by incorporating it with counseling as well. So not only with the medications plus counseling will add up, will help you increase your percentage of quitting.
What is NRT?
NRT stands for nicotine replacement therapy. So you can get it in several forms. You can get it with the nicotine patch, which is transitional and it goes on your arms. You can have the Nicorette gum or the Nicorette lozenge, which they're both oral fixations, and basically what you do is you chew on them and then you park them and then you just park the Nicorette lozenge. The other ones is we have an inhaler, we have a nasal spray, and then you have the other two prescriptions, but they're not nicotine replacement.
What are FDA-approved medications for smoking cessation?
All FDA-approved medications, including the ones that I just told you before about the NRT, so that's the patch, the gum, the lozenge, the inhaler, the nasal spray. Then you have the two prescription form pill forms, Wellbutrin and Chantix.
Can you use more than one medication together?
Absolutely. You can double up on, say, the nicotine patch plus the gum, or you can use the nicotine patch plus the lozenge. You can even take Wellbutrin, which is a prescription pill, with the patch or gum.
Can a pregnant woman use nicotine replacement therapy?
As of evidence-based now, the research that is out there now, they are proving that pregnant women can take it, but in a lower dose. So if they are smoking like a half a pack of cigarettes, 20 cigarettes a day, it is advised to basically give them the lower dose, like the 7-milligram patch. It is, no cigarette is a good cigarette at all, but if they're out there pregnant and they're smoking, there's such an flux of nicotine that they're absorbing. It's safer to take the FDA-approved medication that's giving you a constant flow of medication that is regulated.
Are e-cigarettes healthier than regular cigarettes?
That's a great question, and this is how we answer it. We know that electronic cigarettes are not regulated by the Food and Drug Administration. They're going to be regulated soon, so we don't know what's in them. So we don't have all the research on them yet since they're a new product. We know that they're safer than combustible cigarettes in the short term because there's no tobacco in them that is burning. There's a cartridge with nicotine in it, and there's a battery. So it is safer in the short run, and in the long run, we don't know the answer yet.
Would you say e-cigarettes are a better alternative than nicotine replacement therapy?
How we answer that is we don't think so. The reason is that you remain addicted to the nicotine when you use an electronic cigarette. With the nicotine replacement therapy, you make a plan and you match the amount of nicotine that you're getting normally through smoking or through chewing, etc., and then you match that with the nicotine replacement. Eventually, after a couple of weeks, you start reducing the amount of nicotine. But when you use an electronic cigarette, you're not sure what you're getting, what kind of dosages you're getting, so you can't reduce it over time.
Does it matter how many times someone has tried to quit smoking?
No matter how many times someone has tried to quit, trying to quit again is really important. Because each time you quit, you learn something about yourself, and then you can apply that to your next quit attempt. And you never know when the last quit attempt is going to be the last one forever. So it's really important for people to keep trying.
No, it doesn't matter. The important piece is continuing to quit. And one day, like Tina said earlier, who knows when your last day of smoking is. So you never know. So it's always a good time